Hey, everyone. Yes, it's Dr. Tamara Beckford with Your Caring Docs, where we provide you with health and wellness info so you feel empowered, informed, so you can make some great health and wellness decisions. But we also have a special segment of our Your Caring Docs with Docs Who Care. These are docs from all over the world who are dropping gems, health and wellness info, that is, to let you know what's going on. And the greatest thing about it is that they're going to leave all of their info here so that you can get in contact with them if you want to be part of their team or if you would love to be a patient of them. Today, I got somebody, who is
Hey.
representing them. She went to school in the shop. Ooh, if y'all don't know what that is Chicago. So we have Dr. Katrice Brooks. Dr. Brooks, she went to med school at Loyola University in Chicago, Strick School of Medicine. Then she did her family medicine residency at West Suburban Medical Center. Now, this is the thing about Dr. Brooks. I'm gonna let y'all know about her, right? So she transforms patients' lives with a holistic approach to patient care. Why? Because she really listens and she helps her patients achieve goals. I'm telling y'all, she's about to drop some gem for today. Some gems. I'm gonna give her the woo. Why she gets the woo woo? Because she is gonna let us know how you, our patients and patient population, can save some money. That's cash, that's dough, cheddar, no matter how you put it, right? She's gonna teach you how to save money in healthcare and also how to advocate for yourself, right? That is to make sure that you are empowered, that you ask the right questions, that when you leave that office or that hospital or wherever it is, that you feel and completely understand what's going on with you or your family member or your friend, right? I'm telling y'all, gems, 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 Dr. Katrice.
Yes.
Woo-hoo!
Yes. Hey, hi everyone. I'm
Yeah,
so happy to be here. Hi.
you're not happier than I am. Come on,
You
girl, tell us
I don't know. I'm pretty
some money.
excited. I'm pretty
So,
excited. You're there.
yeah,
Mhm.
so before we get into the crux of all of this, tell me, like, what is it that made you decide that you wanted to be such an impassioned physician who wants to help to save their patients money and also to advocate for themselves? So what is it that brought you to this particular position?
Two things. So first, as a physician, I always wanted to help people. That's like my goal is I want to help people. And for me, help is empowering. It's not a patriarchal sort of, I'm going to do this for you, but I'm going to teach you what I know. I'm going to show you what I know. I'm going to give you everything I have so that you can make the decision for you. Because number one, I believe in patient autonomy. I believe in adults making decisions for themselves. And I want to give you all the information that you can to make a good decision for yourself. That's my goal, right? Like I am my patient's advocate. And so I'm always trying to give them any little power or information that I have. And I
Mm-hmm.
have a patient kind of recently that I found out was paying an astronomical amount from his medication. He's a early 50s, and I found out that for his diabetic meds, he was paying $10,000 every 6 months. He was my patient for years. I had no idea he was seeing a specialist and they were prescribing his diabetic meds. And it wasn't until for some reason my name was on his refill and I'm like, hey, how much do you pay for this? What's going on with this? And he was like, oh, I paid this because he's an entrepreneur and he had the coins. And it never occurred to him to ask about it, to ask if he could save or, and because I'm always trying to empower, I'm always like, you take a weird medicine, this is the fancy new drug on the market. This other equivalent is just the same, right? Like you should take that. So just digging a little deeper and spending time with my patient, I found out he was paying so much money. And then I wanted to now empower all my patients to know, like, you don't have to pay these crazy prices. When that happened, I actually reached out to his specialist, like, hey, I know we got his diabetes to where it needs to be, but how can we save him money? Like how can we change his meds to save him money? Because I know that he doesn't have to take all of this and that there are other ways that he can save. And we did, right? Like we got his
Wow.
medication that cost down, I'm sure less than 300 now, right?
Wow.
We,
From
you know,
10,000 to less than 300.
yes, yes.
Phone call and just being able to know that this is possible, right?
Yes, yes.
Woo!
Having somebody on your side to advocate to say like, you know, you don't have to pay this. You know, this is not, you don't have to spend $20,000 a year to stay healthy. This is not the investment that you need. You do need maybe an investment, but not at this. And he thought he was doing, and he was doing good because he thought he was paying top dollar for his health, which I understand we want top dollar health, right? But we can save our coins in some ways and spend that 20,000 somewhere else, you know, go on a cruise or something that is life enriching for you.
Right.
Yeah.
Wow.
Yeah, definitely.
So in this now, you know, I'm pretty sure that you were already an advocate and you're already ready to say, but then I'm pretty sure that this was catapulted. So, you know what? If one of my patients is having this particular experience and spending this much money, what else is going on with some of my other patients that they're not realizing and they're probably not telling me, right?
Absolutely.
So go ahead and tell us how you're going and how our patients can advocate for themselves and how they can save some moolah.
Absolutely. I'm so excited to tell your audience because these are skills that everyone can use, right? Like there's going to be gems in here that no matter your situation, you can institute something to save some money, something, right?
Absolutely.
So the first one that I'm going to, and there's going to be, I think I'm going to give you 3 to 4 gems and they kind of roll into each other and we'll talk about them. But the first one is kind of know your resources, right? Know your insurance. If you have signed up or have been signed up for a colonoscopy or a test or even a vaccine, for example, the shingle shot, I counsel all the time, and I'm sure you do as well. Medicare will cover the shingle shot for some patients in office and other patients, they'll cover it at the pharmacy, but you don't necessarily know. In my office, we also don't know. There are thousands of different insurances and we don't check for each patient. So if you allow us to come in, and sometimes I'll have a different MA, and this has only occurred once and we talked to the patient, but you know, some people, it's their process to just give the vaccines. And now you get the surprise bill for $700 for a shingle shot that you could have possibly gone to your pharmacy and gotten for free and gotten covered. So know your insurance. Whenever your physician orders tests for you and you are worried about if your insurance will cover it, call them, right? They work for you. They are employed by you. You pay them. So,
hey, right?
Absolutely, right? Like they absolutely. So call them, say, you know, do you cover this? Here, my doctor listed this CPT code or, you know, this code for this test. Are you going to cover that for me? You know, how much will I have to pay out of pocket? They can tell you then, right? And it takes some legwork on our side. It takes time. And for some doctors' offices, maybe they may do it for you. My office, we're overworked and overstressed in the pandemic. So often we unfortunately put the onus on the patient, but it's really your coins, right? So are you going to take this time and save thousands of dollars, right? From a CT or $700 from a vaccine? Or, you know, do you give up your power and allow them to just give you whatever and let them do whatever? Right. And so before we administer anything, when we give you equipment in the room, right? Here's a knee brace, right? You probably can get that same knee brace on Amazon, right? If you can probably take that same code and look it up and get it for $20 rather than paying my office $200 for the knee brace. Absolutely. So, you know, know your insurance, know your resources, dig into those resources. So again, before you accept anything, sign for anything, you know, if you are worried about the money or, you know, if you haven't had it before, you don't know for sure what you're going to get charged, ask. You know,
this is a very important point because as a patient, you know, at times you don't hear a physician telling you to take the time to really check it out. Now, when Dr. Brooks is saying all of this, she's not telling you that like, I don't have time and I don't really care. No, she's just saying that with you advocating for yourself, you'll be able to save money. Now, personal experiences, I think as you're even mentioning, like for women who are about to give birth. That's
Yeah.
another, right?
Big
So
money.
that's a lot of money.
Big
So
money.
you find
Yeah.
out which hospital takes your
Yes.
insulin,
Yes.
hospital. So
Yes.
when you're not hit
Absolutely.
with a surprise bills, especially things that you can kind of
Control.
control a little bit, you know,
Absolutely.
if you're going to birth around hospital C and they, I mean, you just have to just handle that. But if
Yes.
you can look ahead of time, you know, like you said, call the insurance company.
Yeah.
Hey, I am with this and this doctor, and I am, you know, going to be having a baby, and I would like to use this particular hospital. Is it within my insurance? And let them let you know yes or no. And then if they say no, guess what the next step is? Well, let me know which
Yep.
hospitals.
Absolutely. Right. Right. Same.
Absolutely.
Right. For your inhalers, right? Often inhalers are not covered by insurance. They have their preferred inhalers, which ones they like to cover, and your doctor will write for one that's hundreds of dollars, that, you know, that if they're going to pay for it, your copay is hundreds of dollars. Call them and they say they will give you a list of the controlled inhalers they will cover. They know what they will pay for, right? They know what is within the realm, and your contract with them as an insurer says specifically they will cover certain things and how they'll cover it. It's just getting that information to you, and they're not going to call you and let you know. They're going to hit you with the bill after, right? And it's a lot harder to dispute the bill after than beforehand, to have some pre-planning. But then that's another point, right? Dispute your bill, right? I don't want to tell you not to pay your bill, but if you know that that's not what happened, right? Advocate for yourself and, you know, talk about what happened. Call your doctor back to ask what happened. What is this? What does this mean? Right. So, but again, it starts with knowing. So you don't even get into the situation of someone telling you no, right? You already know that the answer is yes, and you're going to go for it, and you have that peace of mind.
Wonderful, wonderful.
Definitely.
So what are some other things that you think that our population and our audience should know that, you know, will help them advocate and or save them money?
For sure. Number two is it's about also advocating for yourself. It's clarifying your visit with your doctor, especially like your PCP. If you have certain visit types from your insurance. So if your insurance allows a physical per year, clarify when you see your doctor, this is my physical, right? Because when I go in there and I haven't seen a patient, or I see a patient, I have a certain agenda for them. It's, oh, I haven't seen them in a year. Let me make sure that they have they have hypertension, diabetes, that I manage these things as a doctor. But you may be going in there like, this is my physical. I don't want to be charged for anything but the physical. So clarify, make sure that you guys are on the same page.
Wow.
That's the same no matter where you go, right? You go to urgent care or something, like clarify the visit and then stick to that visit as well. Some of the onus, I won't say is on you, because the medical industry is part of it is to be nebulous and cloudy so patients are disempowered. That I don't, you know, I want to empower patients, but there is a lot of confusion surrounding it. When you go to the doctor, you don't really know what's going on. Your doctor kind of leads the visit and you leave. That it happened, right? But if you say, okay, well, I have this and this issue, I want to talk about it, you know, is that covered? Is this part of the visit? Is this part of the physical? If someone clearly says that to me, I can say, oh, well, not really. You know, you do have these chronic conditions, and I do have to bill for these conditions, or we can do a preventative visit and maybe not discuss that, or, you know, we can negotiate how to bill the visit that is best for you and that works for you, but that is accurate for me as the physician as well. And that's across all specialties, even when you go to urgent care, right? Like, if you have one concern, that's one type of visit. But if you have one concern, but you also need management of these other things, and you feel like, oh, I'm in front of the doctor, let me tell you this and this, you may get a surprise bill. So again, keep the visit type in mind. If you're going in for a physical, usually that's a preventative visit, and that entails certain things. You can ask your doctor, what does that mean for me? What are you checking? You know, what can I talk about? And they should be able to easily guide you. And no matter where you are in the healthcare, it is our job as physicians to give you that information, especially if you're seeking it. If you're directly asking me, I can't kind of wiggle out of that. This is what it is, right? And I know now that you are conscious about that. So this is a more kind of transparent process. But medicine is not set up to be transparent in that way, which is why we have to advocate for ourselves, because otherwise we will just kind of be shuffled through the system and end up with surprise visits or, surprise bills.
And that's what we're trying to do here with Your Caring Docs, is we're trying to empower you. We're trying to give you an idea of what's going on so that you yourself, when you enter into that office, that building, that hospital, you have an idea of what you're asking for. And with that, it ends up being a two-way street, right? If you are able to ask certain questions, then we're able to provide that info to you, and then you feel empowered. If you still don't understand, clarify, right? Yes. Clarify. So go ahead, give us number 3 on the list.
Number 3 is, it's kind of along the lines of knowing your insurance and your resources. It is using generics and using other third-party marketplace products, right? So for prescriptions, check out GoodRx, right? Look to see what the market price of medicines are. I often have people that tell me, oh, I have to pay $40 for that medicine, or, $90, or, that medicine tripled. And I go on GoodRx and I'm like, oh, it's $10 without insurance, right? You don't even need to use your insurance. Just go on this site and print this coupon, and you can even skip using your insurance. Also, along those same lines, soon I'll be starting a DPC, which is a different type of medical model where you pay monthly for medical care, right? You pay a cash-based price for medical care rather than going and getting kind of a surprise bill from your doctor or an insurance company. But still kind of knowing the products on the marketplace and other ways to save. So that's also advocating for yourself. So using resources like this, Your Caring Docs, to figure out, how do I save the money, right? Like, if my doctor's getting this, how do I save on this, right?
Absolutely.
So again, using things like GoodRx, using cash-based prices. There's a lot of imaging places that allow you to pay out of pocket, and allow you to pay a cash price instead of the price that a big hospital system or insurance wants you to pay. For example, CAT scans and MRIs are often thousands of dollars when you go through big hospital systems, but you might be able to negotiate a cash-based price for maybe $500. And it's finding out kind of on the market what things cost. And in our mind, we think, oh, that's not as good. It is, right? Like medicine, the same, right? Medicines that are generic are FDA regulated to be the same medicine, right? And maybe you might have a reaction to the substrates and the inactive ingredients, but you might have that to the branded medicine as well, right? So it's really the active ingredients, right? And the imaging, what we can get the actual physical imaging that the radiologist read. So these things are comparable, right? Obviously, make sure that they're reputable, right? Don't go on the black market. I'm not advocating that at all.
Advocating black market here.
No, not at all.
What we want you to know is that what Dr. Brooks is mentioning is something I think that's very important, that I do not realize, or I think a lot of people do not realize. And I think I myself, even though we are in healthcare, we still do things just the standard ABC way that the general patient population does it, right? So you'd think like, oh, you're a doctor, you should know. No, we don't. We're not privy to any of this information. We're not privy to know how much it's going to cost that or if you come for my visit, especially in the ER, we get this a lot. Well, is my this covered? Is my that covered? Unfortunately, we're not even privy to any of that.
Yeah.
However, what we do want you guys and all of our audience members to know is that there is, here within the United States, you do have the ability to shop around. And I do not think that people recognize that. I didn't know this until maybe around 5 years ago, or even less, that I found out what?
Right.
I mean, that if I'm given a prescription to get a CAT scan or an x-ray, that I can call hospital A, hospital B, outpatient imaging A, outpatient imaging B, C, or D, and see which one will give me at the most affordable cost.
Yeah.
What? So so that's what we're letting you know, that is possible.
Absolutely. And sometimes it's a big difference in price, right? Sometimes it's not that
Absolutely.
big, but sometimes it's huge.
It's a huge, it can be a huge, it can be a matter of hundreds or thousands.
Definitely, definitely. And
So,
I'm all for people paying for what they value, right? So, if you value something, pay for what you value, right?
mhm,
Definitely. But there are some things that are literally equivalent that you're paying for the brand, or you're paying something that you're not really receiving, right? So if you want to do your CAT scan with your doctors in your hospital because you trust them, pay for what you value, right? Like
mhm.
that is fine. Or you like this surgeon, you trust him, everybody has used them. Absolutely, right? But you may be able to save if you did a little more research.
Hey,
That's it,
hey.
right?
And the thing is that there are people out there that are doing this. And so this is also important for you to know that this
Yeah,
might be new to you and to
yeah,
me, but there are people who've been doing this for a long time.
absolutely.
And so we are now just bringing this information to you so you're on the same level and you can get the same ability to save as those who have been a little bit more diligent in the past. Why?
Sure,
Because we're just enlightening you to the
for sure.
possibilities. Alrighty, so that was number 3.
Yeah,
Got another one.
I think that's it. I have the fourth one is basically advocate for yourself. But that's, just stand up when you have health needs, say, hey doc, I'm really struggling with my meds. Can you help me? Do you know of any sources? And I say, you know what? There's this patient assistance program, or, just partner with those on your health team to use their resources, right? To increase your reach and what you know. I'm
Mhm.
always for partnering with experts because, I have my zone of genius and what I know, and it's medicine. And so all of these things that I'm speaking of, I didn't know until I was a doctor working in the system, right? So I have this kind of behind the scenes knowledge that I'm more than happy to share.
Mhm.
But unless someone lets me know that this is particularly what they're struggling with, I have no idea, right? Like my patient who was paying $10,000 in medicine, I was seeing them for years where we were shooting a breeze. He never said, my medicine is expensive, it stresses me. I guess it didn't, right?
Mhm.
So, if you feel like, oh, I can't afford therapy, and they asked me $300, say, hey doc, do you know how I can do this? And sometimes the answer is not really, but we have a social worker. Let me put you in contact with them to see what resources they have.
Absolutely.
So just advocate for yourself, speak up, let your needs be known, because as a physician, I just want to help, right? I just want to advocate for you and just help you any way I can. If that's helping you get your blood pressure better, I want to do that. If that's helping you get the stuff that gets your blood pressure better, I want to do that too.
Mm-hmm. In keeping in line with this advocating for yourself, in letting your physician have an idea of the struggles or any obstacles that are in your way that's preventing you to be at your optimal self.
Yeah.
If you let your physician know that, then there's a great chance that that physician, or they might be able to direct you to resources to help, right? So they might not know themselves, but as Dr. Brooks mentioned, there might be a social worker, a case manager, or someone who can help to provide that info. And to let you guys know, docs go through this stuff too. I just got my doctor text me at the beginning of this month. Hey, by the way, I just got a notification from the insurance that they're no longer covering your medication. Oh,
Yeah.
okay. What?
Yeah,
What I
definitely.
do. I'm a doctor and I'm taking care
Yes.
of patients and I'm not getting my insurance. So
Yes,
we go through that too, right? And
absolutely.
I mean, what happened is something that was great. My doctor said, I know of a company that actually makes this medication. Would you like me to get you in contact with that
Yeah.
company? Sure.
Yeah.
We did. And I signed up. I got my medication from that company. And guess what? It's way cheaper than what I was paying.
There you go.
There
There
we
you
go.
go.
So doctors go through this too.
Yeah,
So this is
absolutely.
all information is enlightening to us. It's enlightening to me. So what did I just learn? At the beginning of this month, I learned that, wow, some companies that make the medication, maybe you can get your medicine directly from the
Hmm.
company and
Hmm.
end up saving money. Didn't know that, but now I do.
Absolutely.
because it's all a part of healthcare advocacy, patient advocacy, and all about like saving money. So now we know that Dr. Brooks is all about saving the dough and providing a holistic approach, right? She's not just going to take care of you just like, okay, here's a prescription, go handle that. No, she's going to try to find ways to make sure that you can manage all of this so that you are at your healthiest self. Now, when she's doing all of that, she's taking care of you, but we want to know, what does Dr. Brooks do to take care of Dr. Brooks? What do you do for fun? Let me know.
Good question.
Yeah.
So I enjoy photography. That's a hobby of mine. I'm opening a new business, so I love reading books. I'm a huge bibliophile. I'm always listening to audiobooks. That's probably my favorite thing. I enjoy my nephews. So family is really important to me. Being a whole, well-rounded person that, you know, has a good home life as well as work life. I like making sure I have a good work-life balance.
Wow.
Yeah.
Holistic inside and out. Here we
Yeah.
go. What more can we say? All righty. So, Dr. Brooks, all your patients will be happy and they're very blessed to have you as their doctor.
Thank you.
Now, I want my audience to know, where can they find you in case any of them wants to jump on and be taken care of by Dr. Brooks?
Awesome question. Thank you for opening that up for me. So I'm available at my email, hello@katricebrooksmd.com. So any questions, you can submit them there. If they actually want to be a patient of mine, I'm currently licensed in Illinois and Wisconsin. And so they can go to quench.clinic to learn more about my clinic itself. And I'm also available on Facebook. I'm actually hosting Facebook Lives weekly every Thursday at 5:30. And that's just my name, Katrice Brooks. I'm easily found, right? I am on the interweb. So find me. I'm trying to provide more information and empowerment. I have the exact same mission as Dr. Beckford. I really want to empower patients. It just, you know, I have benefited from being empowered and I just want to pass that along, right?
Absolutely.
Just, you know.
Absolutely. So that's info at Katrice Brooks MD. That's KatriceBrooksMD.com. All right. And
Correct.
also at Quench. Go ahead, give us the spelling of
So
that.
it's hello@katricebrookesmd.com.
Hello.
Well, you spelled
Hello.
it correctly. So all of that is correct.
All of that's correct. But it's
Perfect.
hello.
And the website is quench.clinic, and that's QUENCH.clinic, like quench a thirst or a health need, right? Just quench informational need, quench.clinic for the website.
Wonderful, wonderful. Hey, I told y'all we had tea times for you. So this is Dr. Tamara Beckford with Your Caring Docs, and you can find us on Instagram, Facebook, on Twitter, YouTube, LinkedIn at Your Caring Docs. That's URCARINGDOCS. And we can also be found on our website. That's www.yourcaringdocs.com. URCARINGDOCS. I'm Dr. Tamara Beckford with Your Caring Docs. We thank Dr. Brooks for dropping all of this lovely gem here today. And we will see you guys next time. Thanks for listening.